everyone. Thank you so much for joining us. My name is Chelsea Higgs-Wise, and you are watching Marijuana Justice Legalize It Live, Legislative Update Crossover Edition. Again, my name is Chelsea. I am one of the co-founders and executive director of Marijuana Justice. We were founded in 2019, and we're a Black-led organization committed to advancing cannabis legalization while centering equity, justice, as well as decriminalization. When Virginia was legalized in 2021, it was a historic moment, but we also know that we could not stop there. We needed a market centered in equity and supporting small businesses. We also needed an industry that sought to repair the harms of the war on drugs. And we need a retail market that invested back into the communities most harmed by prohibition. And that means that we are here to legalize it right. I am joined today by some of our Canna Justice warriors, Rob and Valerie. Rob and Valerie, could you come on and introduce yourselves before we hop into the program?
Good evening, everyone. I'm Valerie Slater. I'm the Executive Director of Rise for Youth, and Rise stands for Reinvest in Supportive Environments. And I'm also a criminal defense attorney, and I work primarily with youth, and so proud to be a part of the Marijuana Justice Coalition as we do indeed work together to legalize it right. Glad to be here with you all this evening.
And I'm Rob Pogenclass. I'm the Executive Director of Justice Forward Virginia. We are a statewide nonprofit advocacy organization led by public defenders, trying to bring some evidence-informed practices into Virginia's criminal legal system since 2017. And also happy to be a member of the Canna Justice Coalition, working on legalizing it right.
That's right. We have been working together for years. So I asked them to join me today to go over the several bills that we have, not just the retail bill. And we're going to start with just some basics about what crossover is. And then we'll cover the Canna Justice bills with some detail and what's in all of the bills, what's happened so far, and what's next in the bills process and the session in general. It can be very difficult to keep up. And so we're trying to hopefully break down this process for a better understanding. We have also some time built in for questions, but feel free as questions come to your mind to drop them in the Q&A box, and we'll try to get to as many as possible. Sometimes we may not have the answer right away, but we would love to make sure that we can get those answers back to you. And so if there's something that you don't have answered tonight, please make sure you reach out to us and we'll give some information more about how to do that at the end of the program. So before we dive deep into the bills, let's just talk a little bit about crossover. Crossover is in Virginia General Assembly. Crossover is the deadline for a bill to pass out of the Chamber of Origin. So a bill that starts in the House and has an HB number, House bill, has to go through the committee process and pass the entire House of Delegates. And a bill that starts in the Senate that has a bill number that starts with SB, Senate bill, has to go through the committee process and pass through the Senate. If a bill does not pass through the Chamber of Origin, then we call that bill is dead for that year. You might actually see that bills are continued until next year, hear terms like they're laid on the table. All of these are terms that basically say that the bill is not going forward this year in session. Usually, I will say usually. Sometimes we say they can come back alive, but that's not normally the case. When a bill passes its House of Origin, it then crosses over to the other chamber and the process starts all over again. And as you can imagine, crossover is a big deal because it means that you have enough support, you've gotten through one full chamber, you've made it through all of the discussions, maybe the multiple committees that had to be heard, and you've gained a good picture about where your legislators stand, what compromises have been made, and where you might still need to fight. And that's definitely where we are right now. So we're going to go ahead, and now that we've explained a little bit about crossover, if you have any more questions about crossover, please let us know. I will also mention that after crossover, there may not be as much testimony happening. So you'll see a lot of things happening where there isn't public testimony, but the bills are still moving and compromising. And so just understanding that things are still happening and there's still time that for the legislators to make some changes. Our first bill that we're going to start with is our resentencing bill. We have two bills for this, and one is carried by Senator Lucas. That's SB 62 and Senator Lucas is from Portsmouth, as well as HB 26 carried by Delegate Henson from Prince William. And now I'm going to pass it over to one of our coalition members, Rob, to talk a little bit more about the resentencing bill. And thanks again for Justice Forward for really supporting and helping us take the lead on this bill.
Thanks. So I just want to say at the outset with resentencing, this is not the first time we have tried to do this. Senator Williams Graves carried a resentencing bill in 2024. Delegate Henson carried the resentencing bill last year. Both of those were vetoed by Governor Youngkin. And so I just, although marijuana has been legal for adults to possess since 2021, we still have Virginians who are incarcerated, who are on probation, who are on active supervision in their communities for marijuana-related offenses that happened before that legalization took effect in 2021. And Governor Youngkin vetoed those bills, saying that they undermined public safety, which really just flies in the face of everything that we were trying to do to legalize marijuana correctly, which was to recognize the racial impacts of criminalization in the past. And when I say supervision, that's local probation or state supervised probation. So there are still approximately 300 individuals who are incarcerated for marijuana-related offenses, and an indeterminate number in local jails or juvenile detention centers or on some form of supervision or probation. The resentencing bills state that for eligibility purposes, anyone convicted of certain marijuana-related offenses before July 1st, 2021, which was the date that adult use of marijuana became legal, and were still incarcerated or on probation, still will be incarcerated or on probation as of July 1st of 2026 this year. So that's in the future. They will be eligible to petition for resentencing under this legislation. So by September 1st, the Department of Corrections or local jails, regional jails, all of them must identify anyone who meets the eligibility criteria. That is, they were convicted of one of the specified marijuana-related offenses, and they're still incarcerated or on some form of supervision. They must provide a list to the clerk of court where the person was sentenced and send a notification to those individuals that they are eligible for review. Their sentences are eligible for review. And then by October 1st, or within 30 days of receiving the list, the clerk must notify the chief or presiding judge. By January 1st of 2027, the courts must schedule hearings for anyone whose sentences include only marijuana-related offenses. And then by April 1st, they have to schedule hearings for anyone who has marijuana-related charges in addition to some other nonviolent offenses. Maybe they were sentenced to multiple things at the same time. And then after each hearing, the court has 30 days in which to issue its decision. If the judge denies resentencing, they have to provide a written reason. And if the judge grants a new sentence, that must be sent within 5 days to the relevant authorities, whoever is, incarcerating or supervising that person. All of these hearings have to be done by July 1st, 2029. This bill has what we call a sunset provision, which means it will expire. It's an expiration date. So this is all going to happen hopefully pretty quickly. And then, once everybody who's affected has had their opportunity to be resentenced or removed from probation, then the law will expire July 1st of 2029.
Thank you so much, Rob. We're going to continue with the resentencing bill. I know people are already starting to drop questions in the chat. Thank you so much. And don't worry, as we come up to the bill, we will make sure we try and address those questions. So I want to also go in a little bit of the process that happened with the resentencing bill and all of the bills. And I'll start with the House Bill 26 because it went to a subcommittee first. House Bill 26 with Delegate Henson began in the criminal subcommittee House Courts of Justice. And we were really pleasantly surprised at the support. You have to continue to be surprised and optimistic sometimes, even if they've seen the bill before. When it's time to really get going, there can be other surprises. And this time we were pleasantly surprised because the committee chair, Delegate Watts there, was able to actually propose including juveniles or young people, children, to make sure they were included with probation-related cases, even for while they were a child underage. And of course, our coalition was all for this, and shout out to Delegate Watts for that. Really appreciate that. And during the subcommittee, they also requested additional language to ensure that if somebody had been convicted of multiple convictions at the same time, only the marijuana-related portion of their sentence would be reviewed. So just a reminder that this resentencing bill doesn't lead to an automatic resentencing. It doesn't mean to an automatic review. But even if you had more than one charge at the sentencing time, you could still petition for that review, but only the marijuana charge will be looked at. So although the judiciary discretion already covers this, we understood the concerns. There was a lot of opposition because they were saying, well, what if they had a really serious offense or they had another drug on them? Are we going to release people that had, 5 pounds of cocaine on them? And so we really made it clear in this bill that the resentencing was only for the marijuana related crimes on their own. And that was really great. And that it was able to pass subcommittee as well as full courts committee. Because the court review time is considered a fiscal impact, which means it's going to cost the state money. So it's not just the bill language you have to look at. We also have to look at the money behind everything because we look at that state budget. Both of these bills have to go to what we call the money committees. For HB 26, it went to the first General Government Subcommittee of House Appropriations, where it passed and went to the full House Appropriations and then to the House floor and also passed. So really excited to say that our resentencing bill passed the House of Delegates. SB 62 took a little less scenic route. Our patron is the Senator Luis Lucas, and it went straight to full Senate courts. There was also some unwanted amendments from us, but we really continue to make sure that we want this bill to pass. And sometimes they don't take our word for anything, right? They can hear us out. We did not like or support the change. And what that means is that what the change was is that there is a list of people and charges that are excluded from this type of resentencing. And we can talk a little bit more about that later, but the Senate bill is a bit more restrictive. But it did pass Senate courts and it went straight to Senate Finance, where it passed as well, and went to the Senate floor, which also passed. So both of the bills are going to be heard in the opposite chambers now that they have made it past crossover, and we'll continue to have the conversations with the patrons to determine whether they want to continue to amend their bills or not and resolve the difference in conference. Conference is when the House and the Senate end up with different versions of their bills and they go to conference. Literally, the patrons go and they meet in a corner of the Capitol building and they decide what the final version will be. And so we do believe that's what will happen with the resentencing bill as well. Next up, if there are no questions or anything else from that part, I do want to then move on to parental rights. That is HB 942, our parental rights bill that is carried by Delegate Clark of Suffolk. And at its core, this bill addresses a very issue in custody and neglect proceedings. A parent's legal use of cannabis, methadone, or other prescribed medications for opioid use disorder can sometimes be actually used against them in court, even though they are legally prescribed. It is legal use. And even when there is no evidence of harm, and that's the big part, no evidence of harm, basically it says that legal use of legal substances cannot be the only reason why a parent is considered abusive or neglectful. I'd like to invite Valerie Slater in next to chat a little bit more about the bill, and take it away, Val.
Thanks, Chelsea. So it's important to note that this bill, it's not limiting CPS's ability to investigate if a complaint has been lodged against a parent. It does not prevent CPS from intervening if there is actual harm, and it does not stop judges from considering evidence of actual abuse or neglect. And as no one's, I'm sure, surprised to learn that Black and Brown parents are disproportionately impacted by these negative rulings. And data is also showing that in states with legalization, the number of founded cases of abuse and neglect are not increasing, but declining. And so HB 942 in process, it started in the Civil Subcommittee of the House Courts of Justice. And then it passed the subcommittee and then passed the full committee and it passed the House floor. So understand that when a bill starts out, as Chelsea laid out, as she laid out for us, that it's got to go to a small group of folks who have some expertise on that issue. And then it moves on, right? But it passed the entire floor. Now it's been referred to Senate courts. And due to the patron's illness, the bill is it's kind of stalled for a moment, but it's going to be heard sometime next week when the Delegate Clark returns from leave. Now, the focus moving forward is to make sure that the Senate understands how this bill aligns with the legal status of cannabis, methadone, and other prescribed medication, and that it does not stop CPS or judges from doing their jobs. Because anytime there is a bill that is before any committee, we keep hearing those horror stories, right? We want to make sure that everyone is aware that this isn't all of a sudden a stopgap. It's not saying, oh no, no one can investigate. What it's actually saying is when a substance is legal, when a substance has been prescribed, that cannot be the basis, the sole basis for an investigation. Do your job, do it right, but don't do it on the basis of a legal substance. Thanks, Chelsea. I'm going to pass it back to you.
Thanks, Val. Before we move on to the next bill, I just really want to take a moment and tell people that yes, that this is actually happening. Parents that have a medical card have actually had their medical records subpoenaed and seen that certificate in their records, and it's been used against them. And when the judge is stating their reason for impacting the visitation or the custody pieces. We're also just seeing that this is a reason to refer to DSS. We just see this as a reason to continue to bring people into what some folks call the family policing system. And for us, it really also, we've seen across the nation and when talking to people and with the data, that parents actually will stop seeking help because of these types of penalties that could be used against them. So this is a really important piece that I actually take very personally. As a former social worker, I saw this in many homes. And so when we talk about legalizing it right, we have to think even beyond the criminal code of what we might think immediately of impact, and see how it's also impacting the family unit as well as our children, and staying together with their family. So this has been a really important bill. You might have noticed that this bill did not have a Senate number. And that can happen sometimes. This bill, we only had a House patron. And so as it's going right now, and as Valerie said, when it goes in front of the Senate, this will be the first time that the Senate this session has seen it. Very much just like our resentencing bill, this bill has also passed both chambers and made it to the governor's desk twice and been vetoed twice. So this is something that we've continued to work on. And on the last two sessions in 24 and 23, or 25 and 24, excuse me, we were able to pass, but unfortunately was vetoed. All right, next up, we'll move on to our youth decriminalization bill. This is House Bill 1432, and it was carried by Delegate Leslie Mehta of Chesterfield, one of our newer delegates. Congratulations to her. I want to really give a shout out to Delegate Mehta for picking up this bill. Be very honest, Rise for Youth and I worked very closely on this bill. Rise actually helped write this bill, and so it was newer this year. It was not unlike the resentencing, unlike the parental rights. Our legislators had not yet seen this bill specifically. So Delegate Mehta coming in, grabbing this, knowing this issue was really important, is why we want to make sure that this was heard. One of the, this one was really spearheaded again, like I mentioned, Valerie Slater. And so Valerie, let's just start with the problem that you're seeing regarding youth interactions with the justice system and marijuana, and what the bill does. Are you able to talk about that?
Yeah. So, yeah, this bill very near and dear to my heart, because if we go all the way back to legalization, and we began this conversation all the way back in 2019, and as we were having those conversations, we were just repeating over and over again, please, let's be sure that we take care of children as we move forward. We do not want to wage another war on drugs specifically against children. And unfortunately, that is exactly how it's playing out. You know, when we look at the intake complaints against children, so when a child uses marijuana, it's in some ways a status offense, right? Because you have to be of the legal age of 21 in order to legally access, possess, and consume this product, right? Well, children, of course, are under the age, and we are seeing that in communities, there has been a 38% decrease in the number of intake complaints, meaning officers in community are not picking up kids and sending them to the Department of Juvenile Justice or into intake or into court services units for marijuana. But unfortunately, in schools is where we have seen a drastic increase. We have gone from 17% of intake cases from schools to 54%. That is more than tripled. Did you get those numbers? That was 17% in 2019. And in 2024, the number of intake complaints from schools for children using marijuana or possessing marijuana jumped to 54%. That means where it is a class 2 misdemeanor, where there is an actual criminal penalty associated, a criminal charge associated, it's a class 2 misdemeanor to possess or to use cannabis on school property. And so for that tripling of intake cases to happen in schools, that is sending a very loud and very distressing message that we are criminalizing kids, and when we should be looking at why are children using a substance. That's the question that we should be asking. What we have also recognized is that we are not looking for ways to divert children away from the system, but rather sending them right through. And that is disturbing when we look at the age of the young people who are now being processed through the system. Once upon a time, it was the high schoolers. Now, the overwhelming number are middle schoolers. That's our 13 to 15-year olds, the ones who are going through puberty, who are dealing with all of the things that are happening in their lives as they are adjusting to a new school, right? They've gone from elementary to middle school. They're adjusting and dealing with all of the changes happening in their bodies. And now we're saying, and now you're also going to deal with the criminal legal system. We are doing damage. And this bill would have said, we are not going to use that class 2 misdemeanor against children. What we are going to do is instead warn children about how this substance is going to impact their bodies. We're going to notify parents and give them the opportunity to work with their young folks. We are going to determine whether or not these are children who need services and put those services in place. That's what this bill would have done. But unfortunately, there's a thing called the Virginia Way. And the Virginia Way says we've got to study that thing. We've got to look at it a few times. And that's what has happened here. We're recognizing the General Assembly is saying, you know what, we recognize that this is something that needs to be addressed, but we're just not prepared yet to move forward this year. And so it has been set for the 2027 General Assembly session for reconsideration. And so, Chelsea, I'm just going to pause there and, let's have a conversation about this. But it's really disturbing where we find ourselves in the school, particularly with how we're addressing young folks who are either using or possessing cannabis.
That's right. And what we are seeing on the outside of schools with numbers going down, what that means for someone like me that's worked in schools or worked with children is that means that there are just more enforcement tools that the schools are using, and they aren't able to use other pieces that don't create the school to prison pipeline. So as you mentioned, the legislators know something needs to happen, but we are still really figuring out what that was, because we were presenting options of parental notice, of information and education, of referral to services. And it got really into the details about how to track those certain pieces, when parental notification came up, and as well as that fiscal impact of how much this bill will cost. Something that we haven't mentioned today, but if you've been following legal or legislation in Virginia, the budget is a top priority this session because of all of the federal cuts that are also impacting Virginia's budget. So that fiscal impact was really important, that we did not have one. And unfortunately, what we heard was that these parental notifications and tracking the way that we were interacting with youth when we weren't just referring them to law enforcement would have mean that it cost the state more money. And so, Valerie, I just want to give you a moment to respond to those things.
Sure, sure. And, Chelsea, the other thing was, where is it going to be tracked? They were really hung up on who was going to keep track of it. And that's an interesting sticking point, because the court services unit is already the place where we track what's happening with young people that come into contact with the legal system. And so it wasn't as if we were going to have to create a new space for this tracking. And understandably, yes, we do need to set up that process, but July of 2026 is when it would have taken effect. And so it's not as if we were, going to hit the ground immediately running, and there was not going to be time to address that concern. And then as far as parental notification, even outlining what that looks like, it's not as if that truancy is already set up. The way a parent is notified when their child is truant. So we have mechanisms already in place that do this very thing that we were saying under this new piece of legislation that needed to be set up, we have the mechanism already. And so we're not reinventing the wheel. We're not trying to create something new or figure out this new process. It was literally just, okay, how do we take what exists already and ensure that we are not criminalizing children, but rather that we are indeed setting them up with the tools necessary to make age appropriate choices, and then setting families up to be able to support their young people when needed. It's also really important to note that, so what happened with the bill is that it got re-referred to courts of justice from the House floor so that we could address these very things that we're talking about now. And like I said, the mechanisms already exist. And why we got stuck there, I'm not quite sure, but that's okay. We'll come back next year. We will be better prepared to lay it out very clearly, very succinctly. We'll have conversations with court services units and understand. I think I understand pretty clearly, but even to get even a deeper understanding of what that process is and how we might be able to integrate this new thing that will be tracked, this new thing that will be recorded and reported. But what's incredibly important is that even now, even though this bill didn't move forward, that the bills that remain, that we remove that class 2 misdemeanor from schools, because we have seen already that there is a tripling. Are we really going to stand idly by and allow for another year to pass and so many more children to be caught up in the legal system, when what we really need is for young people to be receiving the supports and services that they need, once again, like I said, to make right choices?
It's right. And unfortunately, they are going to wait another year for this to happen. Ultimately, the bill passed out of the committee, but was re-referred back to courts from the House floor. And because of timing, it was too late to be reheard from crossover. Because there was so much conceptual support for youth decriminalization, we're absolutely going to keep working on this. And I think we actually gained some support of more legislators that want to step in and make sure that this happens. And we'll keep working to finding solutions for these concerns and absolutely be back next year. So please make sure you keep up with that. And Valerie, go ahead.
Yes, I had one more thought I wanted to share. And so the thing we were attempting to do was move away from the enforcement mechanism as it relates to alcohol, which is what it seemed everyone was kind of stuck on. Let's align this with alcohol. That's not the appropriate alignment. Last year, we were able to get a bill passed out of the General Assembly that decriminalized very succinctly and allowed for appropriate services for hemp and tobacco. It's much more appropriate to align cannabis with hemp. When you think about all of the products that are on the market right now, that's not cannabis, that's hemp. We don't have a retail market yet for cannabis. And so why wouldn't we align? Why aren't the enforcement mechanisms and all of those pieces, why aren't they aligning with what is actually legal and most likely what children are being caught with in school? And so that was what the ultimate bill or language that we settled on, was to align with that tobacco and hemp, and that it would be to confiscate and to destroy and to determine whether or not appropriate services needed to be put forward for a family or for a young person. And so just recognizing that there's more to it than just, oh, let's find a code section and align it. We need to ensure that when it is aligned appropriately, and that we are not allowing for something that is not a true comparison to be where we find ourselves when we look at children and cannabis. And so I just wanted to add that piece, Chelsea. Thanks.
Of course. Thank you so much for this work. And we have to remember, because I know a lot of people are excited and have questions about the retail bill, but we want to know, like, what does our market look like if we are continuing to really cage and target young people, which and I should have maybe given these stats at the beginning, but prior to decriminalization and legalization in Virginia, the main group of people that were being targeted for small amounts of marijuana were ages 18 to 24. These were our young people. And the age, I named 18 as the youngest age, but that's only because they did not include actual young people in the numbers. So let's remember, if it's absolutely still capturing our young people, and always have, particularly Black and Brown young people, at a disproportionate rate. So this is continued work that we will continue to do. I'm going to also allow us to take a couple of questions before we move to the retail bill. And I will also say that for our resentencing, there is a notification process to everyone that is eligible that comes from the clerk's office. So everyone should be notified. And so that's going to be something that we're hoping to work with DOC and other folks, particularly maybe in the Secretary of Public Safety, as we look at this, to make sure that this process and everyone does have their day in court. And hopefully no one will miss that, but we're continuing to talk about what that means if someone perhaps is overlooked and not notified as they should be. Rob, I'm going to bring you in to address a couple of questions 3 and 4 that were asked in the chat.
Yeah, so question 3 had to do with the resentencing. The person asked, prisons get paid per head. Can we make this any more automatic resentencing, since the system will drag its feet and miss people with this kind of self-reporting? Couldn't agree more with the premise that the system will drag its feet. Of course, DOC and jails will do that. However, I'm thinking back to a conversation that happened in criminal subcommittee with a bill a couple of weeks ago, where someone, a bill patron, came up and said a certain thing was going to happen automatically in her bill. And the first question from Delegate Watts, the chair of the subcommittee, was, what do you mean by automatic? Because nothing happens automatically. For everything that we call automatic, there has to be a process by which some person does something that triggers some response from someone else. I'm not trying to be flip here. I'm just saying there has, even if you call it automatic, you still have to lay out the process by which notifications happen. And so we have tried to do that as best we can in the resentencing bill, so that DOC and the jails will notify people. The notification will come from the clerk. It will go to the individuals. It will go to the incarcerating facilities, the people there, and we have to hope that will work the way it's supposed to. But there is no such thing as automatic. I mean, there's nothing that's going to grab that person and bring them in front of a judge. We've got to make sure that the people are notified. In question 4, let me find it. What about enhanced penalties due to simple possession? Shouldn't that be recognized and resentenced accordingly? So one bill we haven't mentioned yet, that will take effect July 1st, 2026, which passed way back in 2021, is the record sealing law. So one of the ways in which we helped to remedy the wrongs of the past by criminalizing marijuana was to seal the records of people who had marijuana possession specifically. And while the police records were sealed way back in 2020 when we decriminalized marijuana, the court records, which are the public records that are relevant to sentencing enhancements, as this questioner asks, those court records will finally be sealed later this year when the record sealing law takes effect. So there's special provisions in this new sealing law that will go into effect July 1st, and then the automatic part where the state police will be sending lists of records to clerks of court so that those marijuana possession court records will finally be sealed. That will happen October 1st. So we will wait and see how that goes. But back when we sealed the police records, there were over 330,000 records of marijuana possession that were sealed in the Central Criminal Records Exchange, which is the police database maintained by the Virginia State Police of everyone's criminal records. So there will be probably even more court records than that, because one of the difficulties with the sealing of the court records was that lots of people who were summoned for marijuana possession, those summonses never actually got sent to the state police. So the state police in turn was not going to be able to notify the courts because they never got it in the first place. So in 2025, they actually changed this part of the law significantly so that clerks would be able to seal their own records without notification from the state police, without a judge signing an order. If they see that someone was charged with marijuana possession, regardless of what happened to the case, whether it was dropped, they were convicted, they got a first offender disposition, it was dismissed, any disposition, if it has that code section 18.2 250.1, which was repealed back in 2021, adult possession of marijuana, that court record will be sealed this fall when the sealing law takes effect. So there will be no sentencing enhancements for marijuana possession because prosecutors won't have access to those records anymore. All of those records will be sealed later this year.
Thank you so much. And so they might not necessarily be resentenced, but there's been a lot of hard work to make sure that those are sealed and cannot be used against someone later, as we've seen so many times, and collateral consequences. We're going to do one more question before we head to the retail bill. I'm going to pass that one over to you, Valerie.
Sure. Asking, does the youth decrim bill address school expulsion? It does not, but what we're recognizing is, as we're listening to what's happening in the resentencing bill, we are going to have to take a look at all of the consequences that youth have suffered because of the way we treated youth with cannabis in schools. And so while the bill didn't pass, that also gives us the opportunity to set ourselves up to take care of expulsions and all of the other inappropriate. Now, here's the problem with that, if you will. Schools, they are still going to have all of the enforcement mechanisms in place that currently exist. The code of conduct, it says that children are not allowed to have this substance on school property because, number one, they're going to be underage. They're not going to have the legal right of possession or the legal right to use. And so whatever the school's policy, it's going to stand. But the way we're going to be able to address this is to come against those zero tolerance laws in all of the ways that we have, right? That's going to be where our new fight begins. But that's a fight that's going to happen at the school board. And what we can do is look at how we might be able to soften the blow beginning at the General Assembly. But ultimately, we're going to have to leave that final decision in the hands of school boards as to how they are going to move forward. But if we take away the class 2 misdemeanor, that's at least a huge first step. And then if we begin to put into place the ways that we're going to address youth through service provision and recognize that it is a health issue versus a criminal one, that's where we're going to be able to combat this idea that expulsion is an appropriate response. And so, yeah, that's where we're standing on that.
Thank you so much, Val, for that explanation, as well as just talking about the different impacts as well as different approaches that we can take in the future. So now we are going to transition to the retail system. Okay. Now to the big boy, the two retail bills in House, that is HB 642 with Delegate Krizik. And in the Senate, it is started with three different bills, actually. Now everything is rolled into one. So it's SB 542 in the Senate. The chief patron is Senator Aird, as well as co-chief patrons, Senator Lucas and Senator Rouse, who also had the other bills. So I just want to mention that normally there might be several proposals by this time, and usually the first committee, they roll the different proposals and the chamber into one bill that continues forward. And that's what's happened here. Shout out to all of the patrons because these are really large bills. All of them are over 100 pages, depending on how big the font is, sometimes too. And there's a lot of bits and pieces and technical things that have to happen, be reworded, just to stand up a new market, as well as so many stakeholders to listen to, as far as advocates, business folks, agencies. So we really want to thank everyone for their work. Even people on this call have really helped and put in a lot of input. So thank you for listening, and thank you to our patrons for doing all of this and understanding why this is so important. As I said, both bills are over 100 pages, have a lot of technical things in it, but we're going to jump in to discuss the main issues that we've been working on for our next few months. And before I go in, I'll just say that the next steps, if you're wondering where, is that the House bill is now in the Senate and will be heard tomorrow at 8 a.m. Friday. And Senate Rehab and Social Services. And then the Senate bill, which also made it over to crossover, is being heard in the House. And its next step is House appropriations. So let's talk a little bit about the bills. For everyone, it looks like the start dates are a bit different. So in the House bill, the start date is this November 1, 2026. And in the Senate bill, it is January 1st, 2027. Be happy to take more questions about this. And if you're asking which date I think it will be, I really do believe that this will be something that will happen in the very last moment before the bill signing, that we will know an actual date. If you've been following marijuana justice and the Canna Justice Coalition, you will know that we have always really championed for a date that works for Virginia, small businesses, equity, or what we call now impact businesses. I'll go over in a second. But the earlier the start dates, such as November 1 and even January 1, we have been informing the legislators that that really only benefits medical operators that are already set up and can transition basically overnight. And so we really believe that this Virginia market should be led by Virginians as well. And so having a launch date, the first date of Virginia sales, and not having any Virginians be ready because we started sales too quickly, we know that that is also not going to be great for the consumer. Not only have we left out and excluded businesses, but we have also put the consumer in a spot where there's a lack of competition, which normally leads to high prices, low quality, low convenience. And that means that people and consumers will continue to stay with the illegal and underground market. And the purpose now is to move to the legal market when people are still incentivized, truly, even by these early starts, to stay within the illicit market. That's when we also continue to see this disproportionate enforcement happening on poor people, people of color, young people, and why we want to build and have a start date that also makes sense for Virginia. For both of the bills, there are different types of licensing, but they all have a cultivation facility license, indoor and outdoor. They have a processing facility license. There is a micro business license that is all the way vertical. And they're in the House bill. I'll go over that in a little bit, but in the House bill, it's a little bit different right now, where micro business, you can actually also have more than one location in your micro business license in case you need a different cultivation space. And that micro business is about 5,000 square feet. There's also a transporter license, and there's a delivery operator license that is separate. But if you have a retail license, you will also be able to deliver your own product as well. But there is also a standalone delivery license that will not require a brick and mortar. There's also, of course, going to be our testing facility license. And I will say that one of the scientists that have been really advocating around testing has also said that a start date that is too soon will not allow the proper testing facilities to be stood up in time to, again, provide that public health and safety to make sure that the products that we are putting out are actually labeled and doing what they say that they are doing to protect the public health and keeping our word to consumers. And then finally, of course, there's also a retail license. Let's go a little bit deeper into these. The cultivation. So when we talk about canopy is how much space do you have to grow? And so that means that there are 5 different tiers right now. And the tier 1 is up to 5,000, tier 2 up to 10,000, tier 3 15, tier 4 25, and tier 5 35,000 square feet. Tier 1, like I mentioned before, that's that micro license that's meant for small cultivators to be able to use, but it is, if it's a micro license, that is also including your retail facility. And that 35 square feet is going to be the cap. There is some language that the CCA can change up the 2 to 4 and the canopy, but it is written into language very strongly that only 35 square feet is going to be the top number. Now, what we don't have on here is that for medical, they will be able to the pharmaceutical processors or the medical cannabis people that are already set up, they will actually be able to have up to 70,000 square feet, which is twice the number of what an independent Virginia business will be able to have. That is not something that we support. We do not believe that they need that much canopy space for a medical and for adult use. And what we've seen in the past is when you have that much grow space and no one else does, is that you're able to control the market price and specifically price out smaller businesses because they can't afford to charge a lower price to get their product on the shelves, right? And so when you're not at that scale, you can't necessarily meet the price demand, and it starts to exclude some of our small businesses. Next up, let's talk a little bit about the zoning. Perfect. Zoning is 1,000 square feet, and it has some buffers. So not just 1,000 square feet from other businesses, but any place of religious worship, hospital, public school, or institution of higher learning, playground or other recreational activities, child day program, substance use disorder facility, or a state, federal, or local government operated facility. 1,000 feet of any place of an existing retail market store or micro business. And we are saying 1,000 feet, but in the language, it also says that a locality can adopt an ordinance decreasing the minimum distance. So if you're living in a place right now and you think that 1,000 feet is too far, and we will say Marijuana Justice believes that 1,000 feet, particularly in places like Richmond or highly concentrated areas, this is going to zone out a lot of businesses. So if there is a locality that wants to decrease that zoning number, they can. And as I mentioned, now SB 542 also allows for that additional space for a micro license. And that is because there are certain zoning restrictions on having a grow and a retail space. And we're hoping that that type of zoning for another facility under micro will allow micro businesses to find zoning in their areas. I do just want to also mention that I've had a lot of questions, which are really good about, well, is this playground, if someone has a private playground, does that count? As of right now, yes. What does it mean to have a substance use disorder treatment facility? I'm looking that up right now, but overall, we really do believe that these are a bit too restrictive. And there have been sample maps to basically show that if we use this, that there will be barely any particular way to stand up in places, particularly like Richmond. And that means that we won't have the convenience. That means people will continue to possibly shop at the underground markets because, again, even though it is legal and able to sell in that locality, this type of zoning could really push people out. Thanks so much for your questions. I'm going to go through this and then we will address some of the questions. But the zoning piece is something else that we are continuing to talk to legislators about to hopefully change. So next, we are going to look at the impact criteria. I know that this is something else that a lot of people wanted to know. Impact is now our new word for equity. The last 2 years, it was called micro. You know, as many people know, micro business is based on size, and that they just use the word micro because they did not want to use the word equity because the political environment. We have now changed that to impact. Just wanted to make that clear. But let's go over these impact criteria and how to meet that. So one, you must meet at least 2 of the 7. And so, and I know it says 1 or more, but I'm sorry, it should have actually been 2, but 1 actually has to be mandated. So I'm going to go over all 7 first. Sorry about that confusion on the slide. I must have missed that. So 1, you must have been convicted or adjudicated delinquent for any misdemeanor or felony violation related to marijuana. So if you've ever had a marijuana related offense, then you already meet 1. If you are a parent, child, or sibling or spouse of a person that's been convicted or adjudicated, then you also meet that criteria. So if you or a close family member have a marijuana offense, then you can meet that. And if it's you and a family member, then you meet 2. This next one is really important. This next one is something that everyone has to meet in order to be an impact applicant. So when we say you must meet at least this 3rd one, as well as 1 more. So you have to meet at least 2. But this 3rd one is something that is mandatory. You have to at least resided in between the years of 2011 and 25 in a jurisdiction that has been made disproportionately policed based on the U.S. Census. Or you have lived at least 3 of the past 5 years in a historically economic disadvantaged area. I will say that we are attempting to move that 2011 date back in order to really help capture the certain communities that were impacted the most. But this one is the one that you have to meet, as well as 1 more. And additionally, you had to attend at least 5 years of a public elementary or secondary school located in historically economically disadvantaged area. So if you went to a school that was economically disadvantaged as a young person, so the first one I just mentioned, that's if you've lived there in the past 5 years. But if you grew up in an area and you went to school, you can also bring proof of that to qualify. If you received a Pell Grant or attended at least 2 years to a college or university that has at least 30% of the students, then you are also eligible for that. As well as if you are a veteran, and as well as if you qualified as a distressed farmer in the past 5 years with the USDA. So those are the 7 pieces that we're going to look at. And again, you had to meet 2 of those, and 1 of them has to be the residential piece. I expect there might be some changes around that. We don't want to be exclusive about that. I will say that we worked really hard to try and make it mandated that you had a past crime. I do not know if we're in the political environment for that, but we're continuing to work. Some considerations: that preference and licensing process for qualified social equity in applicants. So there is some preference that comes with this impact. So if you qualify for an impact applicant, you will be put in a separate type of lottery system there. Percentage of applications or licensing fees are waived. We do not know what the licensing fees are. That is going to be decided by CCA, but that will be something that those types of fees will be waived or lowered in order to increase participation, even though particularly if people have an inability to pay. There is also a low interest business loan program for impact. And that is our Cannabis Equity Reinvestment Fund that also has the Cannabis Equity Business Loan Fund in it. And that is particularly to help finance startup support for impact licensees. If any time the board determines that an impact license was obtained fraudulently, then that can be revoked. I will also mention something that's not noted is that you are not able to sell off your equity or your impact license if you qualified as an applicant for 5 years. So that right there is because we really want people to get into this, to stay in this. If there are options to sell if you're not up before the 2 years, and then that way you have 3 years to open. There's some benchmarks in there to work with, but we've seen across the country that people will get an impact license and then sell it off really quickly to make a quick buck. And this isn't something that the legislators wanted to just flip. So next, we're going to talk a little bit about the conversion fees that are in the retail bill. First, I just want to mention that the conversion fee is only for those in the medical cannabis right now, and there are only 4 active licenses. They're all out of state. And so I really want to be really clear that right now, these fees only apply to pharmaceutical processors that are vertically integrated. At this moment, both of the bills have a $5 million conversion fee. You might have seen an article I wrote with another expert that said that it should be at least 20 million. I do expect that the House bill, when it comes out, that one of these bills will have at least 15 million in it. And when they go to conference, they might settle at 10. These are all speculations, but it will probably be anywhere between 5 and 15. We believe the conversion fee should be as high as 20 because of the benefits that these pharmaceutical processors are getting, which are, number one, they get to skip the lottery. No one else in Virginia will be able to skip the lottery. Number two, they're going to get the biggest licenses that are not going to be up for applications. They're going to have a full vertical that are way beyond the microscope, and no one else will be able to have that scale, as well as they will have the largest canopy, as I mentioned before, at the 70,000 square feet. So they're coming in with major benefits, and why that conversion fee should be so high in order to help cover some of the cost of some of the other programming for impact that we need the CCA to do. Let's talk a little bit about the taxes, which is also important. We know the taxes are going to be really what decides if someone can afford the product or not. Right now in the House, there is a total around 16.5%. The way that breaks down, it's 6% for the state marijuana tax. It can be anywhere between 1 and 3.5 for a locality to take on those taxes. Your localities can decide how much they want to tax to get in their local budget. And then there's also a sales tax as well at the state level. And the House bill decided to just take the Virginia state sales tax code, which can be anything between 4.3% and 7%. We know places like Nova and Hampton Roads is higher at 6%, but overall it looks like it's around 16.5 for the House bill, which in our eyes is pretty high, knowing that places like Maryland, it's 12%. And many of our medical cannabis folks are actually going to the Maryland adult use market to obtain affordable cannabis products there, because the taxes are just, the medical products here are high priced. The Senate bill, it has a total of 17%, also still very high. The state tax is at 12.875. That sales tax in the Senate is just a blanket sales tax at 1.125 sales tax and 3% at a local tax. Next, I'm going to talk about the revenue and how that breaks down. That is also different. In the House bill, 60% is going to the Cannabis Equity Reinvestment Fund, which means that cannabis equity loan fund that helps with startups or helps with the impact licensees. That is going to have more money because in the House bill, they have a higher percent of the revenue going there at 60%. And then 10% to early childhood, 25% to the Department of Behavioral Health Services, and 5% to public health initiatives. The next one in Senate, their reinvestment looks very similar to what happened when the bill passed in 2021, even though it wasn't enacted because we didn't have a market. That's at 30% of the Cannabis Equity Reinvestment Fund. That means there's half of the money going into that equity fund now. 40% to early childhood, 25% to the Department of Behavioral Health Services, and 5% to the public health initiatives. There's also some remaining concerns that we have, and I just actually released an op-ed at the Cardinal News about this today. And there's conversations from the latest Senate bill right before crossover that the CCA, the Cannabis Control Authority, and the Alcohol Beverage Control would be mandated to merge as one agency. And we are very much against that type of model of having alcohol regulators on top of cannabis, because it does not make sense for us. We've seen in other models, like in Oregon, particularly, that when they do this type of oversight with alcohol, it's really bad for public health, consumers, businesses. There is a cap on the number of retail licenses at 350 right now. And we're still looking at making sure that there aren't a lot of new penalties that come with this, because it goes against the intent of the bill. So that was a lot. I'm sure you have a lot of questions, so I'm going to take as many as I can. And let me get started. I'm going to scroll back up. What is the status of the impact language and the funding plan? I did mention that a little bit before, is that you have to, as of now, qualify for two. One of them has to be residential, and the funding plan is that it goes through the equity loan fund. We're hoping that fund comes online quickly. As I mentioned the start date before, again, why starting so soon? We might not have the fund set up. So those businesses might be waiting on their support system while everyone else gets to go forward. But if we allow more runway time, then that funding will be able to get into the hands of impact applicants and then stand up their business and participate with other folks that are also there. Has the General Assembly been asked about their decision to partner with Metric during their pending class action lawsuit? I really appreciate this question. As we look at monopolies in the cannabis industry and why we are really gung-ho on the conversion fee and making sure that this is not a cannabis industry full of monopolies, we believe that we should also be looking at monopolies in our tracking system, and Metric is definitely one of them. There was some conversations in the Joint Commission that met from July to December, but as of now, they are adopting Metric, and there has not been many questions about why they should not. So that's something that you want to continue to meet with your legislators and talk to them about. let them know about the metric systems lawsuit. They know about it, but just reminding them of where that is going, and continuing to push forward, because we've seen that this is can be really taxing on the business owner. It produces a lot of waste, and sometimes it's just not worth it to a state. There are other ways to be able to track the plants that we have here, without this type of track and trace, particularly with metric in particular. I'm going to go down to the next question about public consumption, or separate language. Yes, I love this question as well. This was talked about a lot in the Joint Commission. And the Joint Commission is 10 legislators that meet outside of session. And at the end, they give recommendations to the General Assembly, to either change the bill, update the bill. And what was decided in the Joint Commission, because they could not agree, is that we're calling them consumption spaces that I'm going to talk about that. Consumption spaces are still going to be really needed, because public consumption is still going to be prohibited. So there's also language in there that localities can increase the penalties for public consumption. We are working to make sure that does not happen. But that is why they are considering, not in the bills this part, but for year 2, they are considering having these consumption spaces, or more widely known as consumption lounges. We like to use the word spaces because they can be a community space. It doesn't also have to just always be recreational. It can be co-working spaces, it can be different spaces. But these are so important because people need places to consume, particularly if they have kids at home or they live at a public housing, which is a federal land and it's prohibited. And so that is coming, I hope, in year 2. If public consumption as well as these consumption spaces is something that's important to you, Chip, please follow in July the commission that's going to meet again. The bills do say that the commission will study them this next summer. And I believe that they will come out with language to do that, and the CCA will provide some different ways to do that to for the commission, so that they can make some decisions about that. Will veteran spouses be included under veteran consideration umbrella? As of right now, they are not. No. And that option has actually never come up for major consideration, and might be something that could be considered, particularly at that joint commission that's coming up. Could be something that we continue to look at, Patrice. Will the CCA have a lottery system for impact licensees? Yes, they will. The CCA has already been sued for its random lottery system used to pick the pharmaceutical processors. Eric, hey there. And you're right, they have. And what the response has been is that the lottery is going to be even more random. It won't have any weighted criteria at all, in order to avoid the lawsuit. I think that the general consensus right now is that if there is not a weighted part of the application, then that type of scrutiny can't be challenged. And that is concerning for a lot of people, because the weight of your application usually makes you a better candidate. Someone that will stand up in this industry. And we are watching people get conditional licenses and never being able to open up, whether it's regulatory pieces or financing or just learning curves. That we have about a 29% profitability rate in the cannabis industry. 29% is not very high. So this is an industry that does require a lot of commitment, and not everyone is going to make it. But that's why some of these weighted pieces might be more enticing, because if you have an application that shows you might be better suited, then we could open that up and we wouldn't lose that license. And then people also might not lose out on their entire life savings. But thank you for lifting that the CCA has been sued. That 5th medical license. I mentioned there was only 4 active because there is 5. There's another one that has not opened up yet because it is still under that type of litigation that was happening. So thank you so much, Eric, for bringing that up. If you are worried about that lottery system, I continue to ask you to reach out to your legislator or please show up in that joint commission and we can continue to talk about how we do this in a way that doesn't make our legislators or regulators regulate in fear, right? Because it sounds like we might be missing out some really great opportunities because we are acting in fear. I will also say, how many small business licenses will be available? That is a great question. As of right now, we don't know that answer. We know that in the beginning, there will be 100 micro businesses that are licensed first, along with a set number of hemp licenses to convert. So there will be the medical operators able to convert. There will be 100 micro licenses that will be given out. And right now it says 10 hemp licenses. We do believe that that may increase, particularly because those working in hemp are folks also already working in cannabis, and it would be more appropriate for them to also convert. And they also have a conversion fee right now in the bills of $500,000. But how many small businesses, we do not know. We mentioned the cultivation licenses in tier 1, tier 2. We are kind of considering those as small business licenses, but there will be continued assessments done by CCA to look to see how many licenses we need where, and maybe what type of licenses didn't stand up. But that is how they'll be doing an ongoing investigation or analyzing how many licenses there will be. Can I talk a little bit about thoughts behind why they would want to merge the retail marijuana and alcohol? It's purely money. As I mentioned before, the federal cuts are here, and that means that there's money that's needed in the budget. Cannabis Control Authority is completely new, and as they build out their adult use market, they're going to need resources. And right now, the General Assembly is saying those resources might be too much. And so, what they're doing is they're looking at other agencies like ABC. And if you've been following, if you've been following alcohol, you know that ABC is not bringing the money in as like they used to. People are just not buying alcohol the same way. And so they have resources that are being unused right now. And so the legislature are looking at how to take unused resources and put them with places that need resources, but only looking at the money as they consider this. It was mentioned in the 2020 JLARC report that it would actually be more beneficial if we were worried about public health and equity to stand up a new cannabis control authority. And that's why Virginia chose to do that. We made a conscious decision just 5 years ago to stand up this new facility and not put it under ABC. And then, as we mentioned before, there are some legislators that believe that we should penalize cannabis the same way that we do alcohol. And if you were following us, our organization, as well as at least 39 other organizations and businesses, signed on to say that we cannot do that because for an extra plant was almost the equivalent of a penalty for murder. So these penalties were able to be taken out after much advocacy. But what we are seeing is that the legislators want something clean, even if it doesn't necessarily, or this definitely does not make sense. These are two separate substances. But unfortunately, this is all about money. And we will say that the alcohol wholesalers are lobbying like crazy for this to happen. If you're watching across the country, alcohol is definitely doing everything they can to get into this business because they've got the distribution set up. They've got the interstate set up. So this is all about a money grab, and really just saying that unfortunately, that is what is happening right now. So we would really continue to love and appreciate that support. We've got about 6 more minutes. I don't see any more questions right now. But I am going to say if you have any more questions and that we didn't get to or they come up later, please email us at info@marijuanajustice.org or DM us on our social media pages. Before I wrap up, I just want to talk a little bit about the process from this point. We start the committee subcommittee process again. That's what we're going through right now. Each bill will receive at least one hearing. They might not go through all of the processes they did prior. Some cases there might be public testimony. I do not anticipate that happening with marijuana, but it doesn't mean it's the end of the conversation, and why you should continue to email your legislator or chat with us about how we can continue to make your voice heard. We'll continue to post on social media as well when the bills are being heard and how you can participate. If you are not subscribed to our newsletter, we send out at least one once a week for updates and other emails for calls to action. So we mentioned it before, so let's talk about it now. We're going to say, hey, what is conference? We talked about conference a little bit about that. When is the House and Senate pass the different versions and they have to go and make it one before it goes to the governor's desk? Conference is a small negotiation process that reconciles the two bills. Leadership from each chamber, usually the patron and someone else, come in. Conferees is what we call them. And the conferees come up with that final compromise. That is in total darkness, total privacy. We do not see any of that conversation or know how they came about. It's going to be a surprise for both of us, all of us, when it comes out of conference. And just important to know, there's like I said, no public hearings or testimony. Once they agree to the final version, they issue a conference report, and that report goes back to the House floor for a vote, and no more amendments are allowed at that point. Even though there are no hearings, advocacy still matters. And so members, you can continue to email them until it is final, and it's not final until the signature. So staying engaged during this phase is really critical. I've brought back in my coalition members just to help wrap us up and tell us a little bit more about what this crossover process looks like. Valerie, you mind taking over?
Sure, sure. So crossover, it really is the time to, what you'll notice is that when a bill crosses over, if it's already been heard in one chamber, they most likely won't take testimony when it comes over to the other side, unless there are new amendments, unless there's something significantly different that's going to be happening with that bill. But if it's the first time that they have heard a bill, then it's going to be as if it's been heard for the first time all over again. All of the testimony is going to be heard, all of those things. One thing I wanted to share about, as we are looking at underage use and possession, I talked a lot about in schools, but what I want to lift up is that college and university students are also, in many respects, captured in that same arena, because, those 18 to 20-year-olds, they are also underage. And so the impact has also been on that group as well. So, in the perfect world, what we were not able to accomplish yet with HB 1432, and one of these bills that has crossed over, we would be able to do a little bit of pinch hitting, if you will, capturing ways to lessen the impact on those populations. Thus far, it has not been successful, but that doesn't mean we stop trying.
That's right.
Because crossover is just the time that we get the opportunity to bring up things that really matter,
Right.
and say those things to folks who may be hearing it for the first time. The one other thing I will add before sending it back, Chelsea, is that if a change is made to a bill as it passed out of the other chamber, then that change, and it passes, it's got to go back to that primary chamber to be heard again on those amendments. And so just because you're able to get a favorable outcome in that second chamber doesn't mean that it's going to last, right? Because it's got to go back to its originating chamber for passage on those amendments. So, like I said, we're going to continue to fight for our youth. Youth for me means anyone under the age of 24. And in the marijuana and cannabis context, it means anyone under the age of 21.
Right.
So that is my fight. I will continue to fight. We look forward to fighting along with those of you who are keen and tuned in to the way as we are legalizing it, we are not making sure that we are protecting those who are not able to legally consume and possess.
Thank you so much, Valerie. And I just want to lift up another partner that's not here, Virginia Student Power Network, that really represents that maybe college age, young person age. Can you flip back to the slide? I know we didn't get to this, but I'm going to mention this part. After session ends, the bill moves towards the governor's action in a reconvened session. Once the bill passes both the House and Senate in an identical form, it goes to the governor, where she, first time we have a woman to say that, has several options. First, she can sign the bill that becomes law, or she can veto the bill, which we felt before, and it goes back to the GA, or she can make amendments, which actually do have to go back to the reconvene session. Reconvene session is one day, and it's April 22nd this year. So mark your calendars for that. During reconvene at the General Assembly, they can attempt to override the governor's vetoes with amendments, but they have to have a 2/3 majority in both chambers to do this. But that does not happen very often. So when session ends, we are not done after March 14th when we adjourn or when it passes. As we move through crossover, where sustain really matters, engagement does matter, we encourage you to stay connected with us. Please follow on social media so you can receive all the real-time updates. Subscribe to our newsletter to get the weekly summaries of what's happening and learn about what is going on in cannabis legalization and industry across the country. And if you're able, and please consider making a donation to Marijuana Justice. This work takes resources and your support. And very quickly, I know we're almost a minute. Gosh, we're really doing great on time. We're 1 minute over, but I am going to ask you both very quickly just to plug your organization name and your where you can be reached, which is also on the screen. Valerie, why don't you go first?
Sure. Rise for Youth, reinvest in supportive environments for youth. If you want to plug in with us, you can find us on Instagram at Rise for Youth, and it's the number 4. And if you want to find us online, it's Rise for Youth, 4 spelled out, FOR.org. And please check out our site. We've got such great programming for young people. We have a youth leader program where young folks can plug in and become advocates. We do a great job of just ensuring that young people understand their political process, and then they're able to come on and be a part of it. And we're setting them up to be the leaders. They're leaders now, but we want to set them up to take the seats of some of those folks sitting that need to go and sit down somewhere else.
Thank you so much, Valerie. Rob?
Yeah, you can find Justice Forward Virginia, justiceforwardvirginia.com or justiceforwardva.com. We're on Instagram, Justice FWDVA. We're on Blue Sky. We're on Twitter. I'm still going to call it Twitter. We're on Facebook. And you can subscribe on our website. You can subscribe to our newsletter, which I recommend. It's free, and we'll give you updates, periodically as things are happening, and so you can stay up to date on we have 20 priority bills this session, 18 of which are still alive. So if you go to our website under the About menu to 2026 priorities, it's up to date on where all the bills stand, if you're interested in criminal legal reform. So encourage everybody to sign up for our newsletter.
Thank you so much. And I swear I'm not going to take up time, but Andrew, if you are still in the room about that Maryland testing, we are looking at that now to see if there are loopholes in our bill for that. But thank you for bringing that up. We will host another session like this around when session ends to discuss what the final bills look like. I want to again thank my coalition members, Rise for Youth, Justice Forward Virginia, as well as Virginia Student Power Network. This is a long process, but it's meaningful work. So thank you for your continued support, and stand with us as we fight to legalize it right in Virginia. Thank you all for joining us, and good night.